Okay, we have already completed our drug acting on CNS. There are some topics we have finished it already. So, for example, we have already completed drug that is general anesthetics from pharmacological point of view, and we have also seen the sedative hypnotics, the anticonvulsants. Okay, we have also seen the local anesthetics. So, there are these chapters we have seen from pharmacological point of view, and we'll see today same chapter from medicinal chemistry point of view. So we have already completed the classification, pharmacological classification, their mechanism of action, their adverse effect, specific indication, specific use, specific toxication, then antidotes, etc. etc. We have seen all these parts. Now, what we'll see now, it's a time for medicinal chemistry, and we'll see the structural aspects of drugs. We'll see the chemical classification of drugs. We'll see the structure activity relationship. We'll try to identify the structures of drug. So we are going to see general anesthetics from medicinal chemistry point of view. So medicinal chemistry, see there are only few things that can be asked from medicinal chemistry. Medicinal chemistry मध्ये तुमचं जास्त काही विचारत नाही GPAT ला. At least what are those important points that will be covered over here. So classification is important, chemical classification of drug that is important. Then structural activity relationship, SAR is important. Okay. Then the structure of drug is important. SAR structure of drug, your classification, and synthesis of only one drug, synthesis of only first member of your family. For example, if you take a barbiturates, so first member will be your phenobarbital. So that synthesis of phenobarbital is important. So if you take a benzodiazepine family, in that case, the first member is nothing but the diazepam or chlorodiazeperoxide. So in that case, that synthesis is important. बट सिंथेसिस सबका नहीं करना है आपको, सिर्फ जो पहला मेंबर है फैमिली का उसका सिंथेसिस करना है, बाकी नहीं किया तो भी चलता है, बाकी दे आर नॉट गोइंग टू आस्क यू दिस टॉपिक. Drug acting on CNS, in that we'll see today general anesthetics, sedative hypnotics from medicinal. So we have seen what is meant by general anesthetics. These are the drugs which will decrease all the modalities of pain sensation. They will abolish, they will cease all the pain sensation, all the modalities of pain. जितने भी पेन का सेंसेशन होता है वो सब क्या करेंगे, एबोलिश करेंगे, बंद करेंगे जनरल एनेस्थेटिक्स. एंड दे विल कॉज रिवर्सिबल लॉस ऑफ कॉन्शियसनेस. So the patient will be unconscious, the patient will become unconscious after giving the general anesthetic, and then he will lose all the sensation of pain. Okay, pain sensation will be lost, and after that the patient will be recovered. So general anesthetics, these are nothing but the drug that will cause reversible loss of consciousness along with the pain sensation. And that's why they are useful in the surgical procedures, surgical management or surgical innovation. So that's why they are useful in the surgery. So we have already seen the classification in the pharmacology, but we will see again quickly. So general anesthetics, they are classified either they are mainly classified into two types. First one is known as a inhalation anesthetics. Okay, and second one is known as a intravenous anesthetic. In the inhalation anesthetics, these are the drugs which are administered by inhalation technique or by using your respiratory tract. These drugs are administered by nasal route, inhalation anesthetics. Okay, and intravenous means they are administered by giving by intravenous injection. So in case of inhalation anesthetics, you have subtypes. First one is a gases. So in that you have cyclopropane, ethyl chloride, nitrous oxide. So out of that, nitrous oxide is also known as a laughing gas. Remember, cyclopropane, ethyl chloride, nitrous oxide. These are the gases. Then second is a volatile liquids. These are not gases, but they are volatile. They are volatile liquid. They are a liquid at room temperature, but if you increase the temperature, they will evaporate. So that's why they are a volatile liquid. Volatile liquid म्हणजे काय, त्यांचं वेपर प्रेशर काय असतं, खूप जास्त असतं. ओके, सो these volatile liquids will have highest vapor pressure. That's why upon application of small amount of heat, they will get evaporated. For example, ethyl chloride, diethyl ether or ether only, simply ether or diethyl ether. Then halothane, chloroform, trichloroethylene. There are a lot of drugs. This is the first class. In first class inhalation anesthetics, you have two subclasses, and in second one is known as the intravenous anesthetics. So these are the anesthetics which are given by intravenous. So these both are volatile in nature. एक तो गैस है और एक क्या है, लिक्विड. तो इनका यूज कहाँ है, they are administered by nasal route. Okay, they are administered by nasal route by a specific apparatus. ठीक है, उनके लिए एक स्पेसिफिक apparatus होता है anesthetic drug administration के लिए. So whatever inhalation anesthetics are there, they are administered by specific apparatus. Okay. Then now second class is intravenous anesthetic. In that mostly you have different classes. Like first one is a barbiturates. So these are nothing but the derivatives of barbituric acid. And what is barbituric acid? We'll see. So in that you have thiopental sodium, methoxytal sodium, methoxytal, mostly ultra short acting barbiturate. तो जितने भी अल्ट्रा शॉर्ट एक्टिंग बार्बिट्रेट है, टोटल ड्यूरेशन ऑफ एक्शन इज लेस देन 30 मिनट. दे आर नोन एज अल्ट्रा शॉर्ट एक्टिंग बार्बिट्रेट. Thiopental sodium, methoxytal sodium. Then non-barbiturate like propofol, ketamine, midazolam. So out of these, propofol you can say it is a phenol derivative. Propofol is a phenol derivative. Then ketamine is a phencyclidine derivative, or ketamine is a narcotic analgesic. Ketamine is a narcotic analgesic. जैसे आपका morphine हो गया, codeine हो गया, thivine हो गया. We have seen that in the pharmacology. So ketamine is a narcotic analgesic. It is also used as a adjuvant, or it is also used as a anesthetic agent. Adjuvant to anesthetic, or it is also single. Also, it is alone. Also, it is used as anesthetic agent. So propofol is a phenol derivative. Remember, write down. Ketamine is a phencyclidine derivative. Phencyclidine. Midazolam is a triazolam derivative. Midazolam is a triazolam benzodiazepine derivative. So it is a main class of this. Midazolam is a benzodiazepine. Benzodiazepine. And उसमें भी एक ट्रायाजोलम नाम का एक सब क्लास है. तो ट्रायाजोलम डेरिवेटिव उसमें मिडाजोलम रहता है, दो तीन एजोलम रहता है. So midazolam is a triazolam benzodiazepine derivative. So propofol is a phenol derivative, ketamine is a phencyclidine derivative, and midazolam is a triazolam benzodiazepine derivative. Then there are certain theories related to general anesthetics, how they act, how general anesthetics acts. So there are two types of theories proposed to show the mechanism of action of your general anesthetics. They have proposed two kind of theories. First one is a Mayer and Overton theory. Remember, Mayer and Overton theory. Mayer and Overton theory. So these two scientists correlated the potency of general anesthetic drug with its lipid solubility. That means more is the lipid solubility of drug, more will be the potency of drug. तो मेयर एंड ओल्टन इन्होंने क्या किया कि उन्होंने एक रिलेशन निकाला कि लिपिड सोलिबिलिटी अगर ज़्यादा है एनेस्थेटिक का तो उसका पोटेंशियल भी ज़्यादा होगा. सो मोर विल बी द लिपिड सोलिबिलिटी ऑफ योर एनेस्थेटिक ड्रग, more will be the potency. That is known as a lipid solubility theory or lipid theory. According to lipid theory, more will be the lipid solubility of anesthetic drug, more will be the potency. Potency मतलब the dose required to produce a certain pharmacological response. So if it is less, then it is known as a more potent. If it is more, it is known as a less potent. So that we have seen already in the general potency. This Mayer and Overton theory, that is known as a theory of lipid theory or lipid theory. Then second one is known as a theory of mechanism of action or theory of protein theory. So in the protein theory, they correlated that the hydrophobic, normally they correlated that general anesthetics, they bind to hydrophobic portion of your proteins. Whatever proteins is maybe a different kind of proteins that are available over the कि nerve में जितने protein क्या है, receptor protein मतलब क्या है, these are nothing but the receptors. Okay, so you can say it is a receptor theory. So there are two types of theories for illustration of your mechanism of action of general anesthetics. First one is known as a lipid theory. So more will be the lipid solubility, more will be the potency. Second one is known as a protein theory or receptor theory. So in that they have mentioned that general anesthetic will interact with the different kind of protein, means receptor, at the hydrophobic sites of the receptor, at the nerve molecule in the nerve. There are the two theories. यहाँ पे इतना याद रखो कि दो थ्योरी होता है जनरल एनेस्थेटिक में, एक होता है लिपिड थ्योरी, दूसरा होता है प्रोटीन थ्योरी और रिसेप्टर थ्योरी. तो यहाँ पे याद रखो दीज एनेस्थेटिक ड्रग्स विल बाइंड टू हाइड्रोफोबिक साइट्स ऑफ योर रिसेप्टर्स. सो जैसे फॉर एग्जांपल गाबा रिसेप्टर हो गया, ग्लाइसिन रिसेप्टर, ग्लूटामेट रिसेप्टर, एनएमडीए रिसेप्टर. फॉर एग्जांपल नाइट्रिक ऑक्साइड विल इंटरेक्ट विद द NMDA receptor, N-methyl D-aspartate. For example, whatever barbituric acid benzodiazepine derivative, they will interact with the GABA receptor. Okay, that means receptor are nothing but the protein. That is known as a protein theory. समझ में आया यहाँ पे? Are you getting or not? समझते क्या? याद रखो there are two main classes, intravenous and inhalation. Inhalation में आपका दो टाइप आता है, gases volatile, और intravenous में आपका यहाँ पे इंटरवेंस में बहुत सारे सब क्लासेस कर सकते हो। बारबिचुरेट्स, एक तो बारबिचुरेट्स हो गया आपका, दूसरा हो गया नॉन बारबिचुरेट्स। अभी नॉन बारबिचुरेट्स में आप डिफरेंट डिफरेंट क्लासेस कर सकते हो, जैसे फिनॉल। फिनॉल में आता है आपका प्रोपोफॉल, फिनॉल डेरिवेटिव, पेनसाइक्लिडीन और पेनसाइक्लिडीन डेरिवेटिव, और यू कैन से इट इज अ नार्कोटिक एनालिसिस, केटामाइन। देन बेंजोडाइजिपिन में आपका आएगा आपका मिडाजोलम, ट्रायाजोलम डेरिवेटिव, मिडाजोलम एंड ऑल। These are the there are subclasses we'll see it again. Then theories related to anesthetic. Remember Mayer and Overton theory. Mayer and Overton theory, that is known as a lipid theory, and another theory is known as a protein theory or receptor theory. Now we'll see general again classification of general anesthetics. It is a pharmacological classification again. So they are classified into two major classes: inhalation anesthetics and intravenous general anesthetics. So in inhalation anesthetic you have two: gases plus volatile liquid. So gases, in that you see nitrous oxide is known as a laughing gas. Why it is known as laughing gas, I will explain. So this nitrous oxide will cause delirium and hallucinations. This nitric oxide, when given, they will cause delirium or hallucinations, and that's why when any patient is on nitrous oxide, and if anybody started laughing, then patient will laugh continuously. Nitrous oxide. Then volatile liquid, in that you have ether, diethyl ether. Then halothane, isoflurane, desflurane, sevoflurane, enflurane, etc. So they are nothing but the halogenated hydrocarbon. So इनमें क्लोरीन वगैरह रहेगा, क्लोरीन एंड क्लोरीन ब्रोमीन इसमें रहेगा। हेलोथेन, आइसोफ्लोरीन, डेस्फ्लोरीन, सेमीफ्लोरीन, इनके स्ट्रक्चर में क्लोरीन रहेगा, ब्रोमीन रहेगा, और आपका फ्लोरीन भी रहेगा। These are the inhalation. Now second one is known as a intravenous. Okay, intravenous. So fast acting drug. In that you have fast acting means ultra short acting barbiturate drugs. Fast acting drug. So in that you have thiopentone, sodium, methoxytone, sodium, or methoxytone, sodium, propofol, and etomidate. Etomidate. Okay. Next subclass of your intravenous, that is nothing but the slower acting drugs. ये थोड़ा सा धीरे से एक्ट करेंगे। फास्ट एक्टिंग ड्रग मतलब इनका वन सेट ऑफ एक्शन क्या है इनका, बहुत ही फास्ट है। मतलब इंजेक्शन देने के बाद विद इन 2 minutes और 3 minutes patient will become unconscious or patient will get anesthesia. That's why they are known as a fast acting. Slower acting drug means these drug, if they are administered to patient, it will take around 15 to 20 minutes to induce the anesthesia. So induction time for this fast acting drug is less, and induction time for slower acting drug is more. Okay, so that is the difference. Why fast acting drug and why slow acting? Fast acting drug क्या करेंगे, जल्दी ही anesthesia प्रोड्यूस करेंगे विद इन 3 minutes और 3 or 4 minutes. Then these slower acting drug means they will produce anesthesia within either 20 minutes, 30 minutes. Okay, so that's why they are slower acting. In that you have benzodiazepine is like diazepam, lorazepam, midazolam. So out of these also, these are known as a benzodiazepine derivative. Lorazepam and diazepam, these are the pure benzodiazepine derivative. But this midazolam is known as a triazolam derivative. Zolam, देखो, ZOLAM. So triazolam derivative, midazolam. Then opioid analgesics, so fentanyl, sufentanil, and alfentanil. There are three drugs that can be used as a general anesthetic. Fentanyl, sufentanil, and alfentanil. यहाँ पे एक ही एग्जांपल दिया है, मैं तीन बोल रहा हूँ. We have seen this topic already. You want to revise, you can go and watch that video. Dissociative anesthetic, that is a ketamine dissociative anesthetic. ये क्वेश्चन कम से कम 3 बार पूछा है जीपैट में. Which one of the following anesthetic agent will produce dissociative anesthesia? Ketamine will produce dissociative anesthesia. 2-3 बार ऑलरेडी क्वेश्चन पूछा है. Ketamine will produce dissociative anesthesia. Dissociative anesthesia मतलब ये क्या होता है, मैं आपको बोलता हूँ. आई थिंक मैंने ये ऑलरेडी फार्माकोलॉजी के टाइम पे आपको बोला है व्हाट इज मीन बाय डिसोसिएटिव एनालिसिस. So patient will see each and everything what is going over there in the operation table, but he will not be able to react. So ketamine will produce detachment of patient's mind detachment will be there from environment. जैसे सामने आपका जैसे आप देख रहे हो, आप कॉन्शियस हो, ये कॉन्शियस तो रहता है. केटामाइन का इंजेक्शन देने के बाद में कॉन्शियस रहता है, उसको सब दिखता है. ठीक है, उसको दिख रहा है कि डॉक्टर लेके आ रहा है बड़ा सा एक कटर, उसको मालूम है कि अभी ये मेरा पैर काटने वाला है, लेकिन कुछ नहीं कर सकता. मतलब कुछ नहीं कर सकता. दैट इज नोन एज डिसोसिएशन ऑफ पेशेंट्स माइंड फ्रॉम द एनवायरनमेंट. दैट इज नोन एज डिसोसिएशन. दिस केटामाइन प्रोड्यूसेस डिसोसिएटिव एनास्थेसिया. इसके ऊपर कम से कम 2-3 बार क्वेश्चन है, और इसका क्लास याद रखो. मिडाजोलम इज अ triazolam derivative. Triazolam derivative. Midazolam is a triazolam derivative. Propofol is nothing but the phenol derivative. Propofol क्या है? That is a phenol derivative. Okay? Intermediate एक carboxylic acid derivative. Intermediate is a carboxylic acid derivative. Chemically थोड़ा सा आपको बोल रहा हूँ. Chemical classification. Pharmacological classification we have seen lot of times. Now next point we'll see. Now properties of ideal inhalation anesthetic. So what are the properties of ideal inhalation anesthetic? Inhalation anesthetic, ideal anesthetic किसको बोलेंगे? What is the ideal anesthetic? So ideal anesthetic agent should have it will produce adequate analgesia. Okay. So the main aim of anesthesia is to operate the patient. Anesthesia क्यों करना है? क्योंकि आपको ऑपरेशन करना है and patient should not feel the pain. That's why a ideal anesthetic agent will produce anesthesia, adequate anesthesia plus adequate analgesia. Analgesia means loss of pain. Anesthesia means loss of consciousness. Okay? So ideal anesthetic agent should produce analgesia more than anesthesia. Okay. Then induction of anesthesia and recovery from the anesthesia should be smooth. So induction and recovery should be smooth. It should be non-inflammable. It should be non-inflammable, non-irritant, and it should have adequate muscle relaxation. It should be non-inflammable, non-irritant, and it should have adequate muscle relaxation property. So I'm not taking each and every point like your semester exam, but whatever is important that will be discussed. Okay. So these points you have to remember. Ideal anesthetic agent should have adequate analgesia, analgesia. It will produce adequate anesthesia. It will induce anesthesia smoothly. The patient should recover from anesthesia smoothly. It should be non-irritant to your GI, non-irritant to your respiratory tract. It should be non-inflammable. It should have adequate muscle relaxation so that the operation will be. So what are the different inhalation anesthetic? So first one is the diethyl ether. So anesthesia का आपको stages कितना होता है, mechanism क्या है, वो already अपन ने देखा है. So still I want to revise it. So what is the mechanism of action for general anesthetics? So they acts on a different receptor in the brain. So there are volatile anesthetics will act differently, non-volatile anesthetic. So mostly intravenous anesthetic जो है वो क्या करेंगे? Intravenous anesthetics they have their own targets. For example, benzodiazepine, barbituric acid, and all that. They will act on a GABA receptors. Okay, so they are the GABA agonists. They will increase the level of GABA. They will increase the chloride ion channel frequency. GABA gated chloride ion channel. So post-synaptic membrane will be hyperpolarized and there will be inhibitory effect or suppression of your cells. So that is a mechanism of action for your intravenous anesthesia. They are either GABA agonist or they are either glycine agonist or they will inhibit the excitatory neurotransmitter like NMDA. Okay, तो excitatory neurotransmitter जो है आपके ब्रेन में उसको कम करेंगे या फिर inhibitory neurotransmitter जो है उसका पोटेंशिएशन करेंगे. So that's how intravenous anesthetics they will act. Now you should remember what is meant by minimum alveolar concentration. So we have seen that in the pharmacology. So remember nitric oxide is having nitric oxide is the gaseous anesthetic which has a largest MAC, minimum alveolar concentration. That's why nitric oxide is the least potent drug. Okay, nitric oxide की पोटेंसी बहुत ही कम होता है क्योंकि उसका alveolar concentration जो लग रहा है वो लग रहा है ज़्यादा. And most potent को है most potent है methoxyfluorine. Methoxyfluorine is the most potent inhalation anesthetic. ये याद रखो, ये already pharmacology में मैंने बोला है. Now medicinal chemistry. So diethyl ether क्या है? Diethyl ether. So it is a clear and colorless liquid, volatile. It is a clear colorless volatile liquid. So it is a soluble कणिका. You should have please be on time. टाइम जो दिया है उसके टाइम पे ही आते जाओ. क्या होता है कि बाकी डिस्टर्बेंस होता है, बाकी डिस्टर्बेंस नहीं होना चाहिए. फ्लो अगर जो चल रहा है उसको फ्लो में चलता है ना, अगर कोई फ्लो तो टूट जाता है तो फिर मूड ऑफ. सो डाइथाइल ईथर वी आर सीइंग डाइथाइल. सो डाइथाइल ईथर again it is a gas, it is a inhalation anesthetic. It is a clear colorless liquid. It is a volatile and highly inflammable. It is highly inflammable. It is soluble in water, alcohol, and fatty oil. Methylene chloride also. It is soluble in methylene chloride also. Now remember over one thing here. Okay. So increase in the chain length. Increase in the chain length will increase the toxicity as well as potency. Increase in the chain length of this डाईथाइल ईथर. So it is a structure of your diethyl ether. You can see over here. ये हो गया आपका इथाइल, ये भी इथाइल हो गया डाईथाइल. So its chemical name is 1,1 bisoxyethane or 1,1 oxybisethane. 1,1 oxybisethane. So that is nothing but the ether or diethyl ether. So remember this structure and उसका जो नेम है आईपैक नेम कभी कभी बहुत बार chances रहता है उसका आने का. So IPAC name is also important. Okay. Remember increase in the chain. Increase in the chain. That means methyl chain. इथाइल की जगह प्रोपाइल डाल दो, प्रोपाइल की जगह ब्यूटाइल डाल दो. अगर उसका चेन बढ़ाएंगे आप, so that will again increase the toxicity. So increase in the toxicity result because of the increase in the chain. ये चेन लेंथ जो है आपका, यहाँ पे देखो क्या है, इथाइल CH3 CH2. अगर यहाँ पे प्रोपाइल डाला आपने, यहाँ पे ब्यूटाइल डाला, यहाँ पे पेंटाइल डाला, मतलब dipentyl ether, dibutyl ether, dipropyl ether. So that will become more toxic. Then unsaturation in the aliphatic ether increases the potency and decreases the duration of action. यहाँ पे नॉर्मली क्या है, यहाँ पे डबल बॉन्ड्स नहीं है. अगर इसमें अगर डबल बॉन्ड डालेंगे, यहाँ पे डबल बॉन्ड डाल दिया, यहाँ पे एक डबल बॉन्ड डाल दिया, क्या होगा? सो अनसैचुरेशन इन द एलिफेटिक ether results in the more potent compound, but the duration of action is decreased because see, introduction of double bonds over here will increase the lipid solute and will decrease the duration of action. That's why potency is increased but duration of action is decreased. That is the SAR of your diethyl. Then next drug is nothing but the trichloroethylene. So it is a weak volatile anesthetic agent and it is used for the induction of anesthesia for short surgical procedure. जो छोटे छोटे सर्जिकल प्रोसीजर होते हैं उसके लिए इसका when mild anesthesia is required or mild anesthesia is desired. So if you require mild anesthesia, for example tooth extraction, आपका अगर दांत निकलना है, that require a mild anesthesia, tooth extraction for example. Okay, likewise that. So trichloroethylene is a weak volatile anesthetic agent used for the short surgical procedure and for when mild anesthesia is desired. So you can see over here that is the structure of your trichloroethylene. So what is the effect name? 1,1,2 trichloroethylene. 1,1,2 trichloroethylene. ये 1,1,1 dichloro 2 chloro सभी बोल सकते हो या फिर आप ऐसा लिख सकते हो 1,1,1,2 trichloro. That is a trichloroethylene. Now next one is a halothane. So okay, next one is a halothane. So it is known as a fluorinated hydrocarbons. Okay, so fluorinated hydrocarbons. So halothane, this is the structure of your halothane. इसका IUPAC name already पूछा है. So what is the IUPAC name of this compound? See, carbon number 1, ये carbon number 1 हो गया, ये carbon number 2. Here 3 fluorines. So 1,1,1 trifluoro, 1,1,1 trifluoro. Then 2 bromo. यहाँ पे एक ब्रोमीन है, यहाँ पे एक क्लोरीन है. So 2 bromo 2 chloro, 2 bromo 2 chloro 1,1,1 trifluoroethane. It is the IUPAC name of halothane. इसके ऊपर क्वेश्चन आ चुका है. So one of the following is the halothane. ऐसा पूछा था. One of the following drug is halothane और नीचे ऑप्शन में दिया था आपको IUPAC name. तो उसमें का ये IUPAC name 2 bromo 2 chloro 1,1,1 trifluoroethane. That is the IUPAC name of your halothane. ये क्वेश्चन GPAT में पूछा है. Halothane is nothing but the volatile liquid. It is a general anesthetic. It is administered by NOE technique. NOE technique मतलब क्या? यहाँ पे नाइट्रस ऑक्साइड प्लस एयर और ऑक्सीजन इनमें अपना हेलोथेन ड्रग प्लस नाइट्रिक ऑक्साइड, ड्रग प्लस एयर प्लस ऑक्सीजन, ये टेक्निक से उसको एडमिनिस्टर करते हैं. मिक्सचर, सो इट इज अ मिक्सचर ऑफ योर एनेस्थेटिक एजेंट प्लस एयर प्लस नाइट्रिक. So that is used along with NOE technique. It is again explosive in nature, explosion होता है उसका, and it will causes dose dependent respiration depression. Yes, NOE technique. यहाँ पे NOE technique मतलब क्या? गैस प्लस आपका ड्रग प्लस एयर, उसका टेक्निक. ठीक है, तीनों मिक्सचर, इट इज अ मिक्सचर ऑफ गैस, ओके, एयर मिक्सचर प्लस आपका जो ड्रग है उसका एक मिक्सचर. सो ऐसे नाइट्रिक ऑक्साइड प्लस ये नाइट्रिक ऑक्साइड, ये जो आपका गैस है नाइट्रिक ऑक्साइड. देन O मीन्स आपका एजेंट एंड E मीन्स एयर. NOE टेक्निक, दैट इज okay. So NOE technique, it is used in the mixture nowadays, not used halothane and all that. नाउअडेज आजकल जो एनेस्थेटिक का प्रैक्टिस है उसमें ये सब वोलेटाइल एनेस्थेटिक कौन यूज करता है, कोई यूज नहीं करता. सो बट एनओई टेक्निक यूज, एनओई टेक्निक मतलब मिक्सचर यूज करते हैं उसमें. डायरेक्टली आप पूरा ड्रग यूज नहीं कर सकते. मिक्सचर, एयर का मिक्सचर प्लस नाइट्रिक ऑक्साइड का मिक्सचर, नाइट्रिक ऑक्साइड एयर एंड ड्रग, ये तीनों का मिक्सचर यूज करेंगे. दैट इज नोन एज एनओई टेक्निक. गॉट इट. एनओई टेक्निक, नाइट्रिक ऑक्साइड आपका एजेंट मतलब जो हैलोथेन है, नाइट्रिक ऑक्साइड हैलोथेन एंड एयर, ये तीनों का मिक्सचर यूज करना है. दैट इज एनओई टेक्निक. नाउ रिमेंबर हैलोथेन is metabolized to three compounds. Body it is metabolized to three compounds. First one is known as a trifluoroacetic acid. Second one is known as a N-trifluoroacetyl ethanolamine. N-trifluoroacetyl ethanolamine. Then third compound is known as N-acetyl S2-bromo 2-chloro 1,1 difluoroethyl cysteine. These are the metabolites. Metabolites याद रखो थोड़ा सा. What are the metabolites? So halothane is metabolized in the body to this component. First one is known as a trifluoroacetic acid. Okay? First one is known as a trifluoroacetic acid. यहाँ पे देखो ये trifluoro. Then second metabolite is nothing but the N trifluoroacetyl ethanolamine. N trifluoroacetyl ethanolamine. Then third one is nothing but the N-acetyl S2-bromo 2-chloro 1,1 difluoroethyl. So this halogen is metabolized into body in these three metabolites. ये तीन metabolites होते हैं halogen का. So remember these three: trichloroacetic acid, N-trifluoroacetyl ethanolamine, and then N-acetyl 2-bromo 2-chloro 1,1 difluoroethyl. It is a non-inflammable. ये it is a non-inflammable. Explosive है लेकिन it is a non-inflammable. Colorless, heavy and clear liquid, slightly soluble in water, miscible with ethanol, trichloroethylene, and it will produce this halogen will produce any depth of anesthesia without causing hypoxia. Hypoxia मतलब less oxygen. So it will produce anesthesia without causing hypoxia. It is a non-irritant. It is used with the nitric oxide. ये जो है ना NO NOE अभी ये समझ NOE मतलब क्या? N मतलब नाइट्रिक ऑक्साइड. ठीक है. NOE N मतलब नाइट्रिक ऑक्साइड. आपका ड्रग एजेंट halogen, that is halogen, nitric oxide agent plus air, NOE tank for anesthesia. It is used along with the nitric oxide for inhalation anesthesia. If you want a proper surgical proper muscle relaxation, so you can combine this halogen with the skeletal muscle relaxant. For example, succinylcholine or D-tuberculin. Curare alkaloids or succinylcholine. They can be used along with the halogen when you require proper skeletal muscle relaxation. So remember this structure also. halogen का structure important है, इसके बारे में क्वेश्चन ऑलरेडी आ चुका है. इसका आईपैक नेम पूछा है एक बार. Then next one is a methyl methoxyfluorine. Methoxyfluorine. So it is a structure of your methoxyfluorine. It is a structure of your methoxyfluorine. 2,2-dichloro 1,1 dichloro 1 methoxyethane. You can see what 2,2-dichloro. ये हो गया आपका कार्बन नंबर 2. कार्बन नंबर 2 है, ये कार्बन नंबर 1. दिस इज कार्बन नंबर 1, दिस इज कार्बन नंबर 2. 2,2-dichloro 1,1 dichloro 1 methoxyethane. ठीक है, ये दो methoxyethane. That is a methoxyfluorine. Rest of the things are similar to halogen. बाकी का जो properties है वो halogen की जैसे है. But remember, it is a non-explosive, non-inflammable, and it releases the fluorine molecule in the body. It releases the fluorine molecule in the body. That's why that fluorine molecules or fluorine ions, whatever fluorine ions released by this methoxyfluorine, that causes the neurotoxicity and nephrotoxicity. Methoxyfluorine is metabolized in the liver and produces fluoride ion. Fluoride ion, oxalic acid, then difluoromethoxyacetic acid, difluoroacetic acid. Okay, these release the whatever fluoride ions are released, they cause renal damage, they causes neurotoxicity. तो याद रखो यहाँ पे जो fluoride ion को release करता है वो कौन है? methoxyfluorine. And because of that renal toxicity is there, neurotoxicity is there. So it is again a colorless liquid, non-inflammable, non-explosive anesthetic agent. It is used for the it is used to produce light anesthesia with a deep analgesic action and muscle relaxation. So this methoxyfluorine has a anesthetic action as well as along with that analgesic action, along with that muscle relaxant action. So whenever you require a deep anesthesia or deep anesthesia, you can use this methoxy. Remember, this releases the fluoride ions in the body that causes the renal damage and neurotoxicity. आपका नर्व को डैमेज करेगा, आपके renal kidney को डैमेज करेगा. because of the fluorine release. Okay, याद रखो. Next one is known as N-fluorine. N-fluorine. So it is an alternative to halothane. Again, this N-fluorine is alternative to halothane. Again, it is metabolized into these compounds. It is a difluoroethoxy difluoroacetic acid. Fluoride ion also a major metabolite of this N-fluorine. So this N-fluorine will have all qualities of ideal anesthetic agent. Remember. So इसके ऊपर भी एक बार क्वेश्चन आया था. One of the following is considered as an ideal anesthetic agent. Remember N-fluorine. N-fluorine will have most of the qualities of ideal anesthetic agent. इसको ideal anesthetic agent बोल सकते हो. It will have most of the qualities of ideal anesthetic agent. Ideal inhalation anesthetic agent. So N-fluorine. इसके बारे में क्वेश्चन पूछ. Now what is the structure of N-fluorine? Structure you can see the last structure. Number 3, structure of your N-fluorine. So 2-chloro 1 into difluoromethoxy 1,1,2 trifluoro. इथेन मॉलिक्यूल कहाँ पे है इसका? ये जो है इट इज इथेन. सो 2-chloro मतलब ये 2 कार्बन नंबर 2 है और ये कार्बन नंबर 1. सो 2-chloro into 1 difluoromethoxy into ये देखो 1 है difluoromethoxy. ये difluoro 2-chloro 1 into difluoromethoxy 1,1,2 trifluoroethane. 1,1 ये 1,1 हो गया 2. So 1,1,2 trifluoromethane. So sorry, trifluoroethane. So 2-chloro 1 into difluoromethoxy 1,1,2 trifluoroethane. That is nothing but the N-fluorine. Remember, try to remember the which one is the ideal one. So N-fluorine is known as a ideal anesthetic agent. Okay. Methoxyfluorine toxicity करेगा ये करेगा neurotoxicity and आपका renal toxicity because of the release of fluoride ions. फ्लोराइड आयन रिलीज करेगा ये और उसकी वजह से न्यूरोटॉक्सिटी होगा आपको, मतलब नर्व डैमेज हो जाएगा और आपका किडनी में भी प्रॉब्लम हो जाएगा. सो दैट रिलीज ऑफ फ्लोराइड आयन विल कॉज रिनल डैमेज एंड न्यूरोटॉक्सिटी. सो हेलोथेन याद रखो. हेलोथेन का ये हाइपैक नेम पूछा है ऑलरेडी. इसका हाइपैक नेम ऑलरेडी पूछा है इसका. नाउ विल सी द नेक्स्ट आइसोफ्लुरेन. सो आइसोफ्लुरेन इज अ sweet in the taste. It is again ideal anesthetic agent. It is a non-exclusive. ये भी ideal anesthetic agent है. इसका भी property ideal है. So sweet in taste, ideal inhalation anesthetic, and it is a non-explosive. So what is the structure of isoflurane? N-fluorine जो है उसका ये isomer है. N-fluorine होता है आपका. Whatever N-fluorine is there, so it is a isomer of that. So you can see over here structure 2-chloro 2-difluoromethoxy 1,1 trifluoro. यहाँ पे 1,1 trifluoroethane. 2-chloro ये कार्बन नंबर 1 कार्बन नंबर 2 into क्या है ये सब है 2 into difluoromethoxy 1,1,1 trifluoro. That is the isoflurane. Next one is a desflurane. So it is a structure of desflurane. Rest of the most of the qualities of these fluorinated hydrocarbons are the same. So you can see desflurane 2-difluoromethoxy 1,1,2 tetrafluoroethane. सबसे ज्यादा फ्लोरीन किसमें है? इसमें टेट्राफ्लोरोइथेन. 2-difluoromethoxy 2 into difluoromethoxy हो गया 2 into difluoromethoxy. कार्बन नंबर 2 ये है 1,1,1,2 tetrafluoroethane. ये 3 फ्लोरीन tetrafluoroethane. Now next one is the sevoflurane. So you can see over here यहाँ पे कार्बन नंबर 1,2 hexafluoro 2 fluoromethoxy. ये कार्बन नंबर 1 हो गया. ये हो गया 2 fluoromethoxy propane. एक 1 2 3 कार्बन नंबर 3 कार्बन नंबर 2 कार्बन नंबर 1. So propane. So 1,1,1,1,1,3,3,3 hexafluoro 2 into fluoromethoxy propane. That is a sevoflurane. Now next we'll see intravenous anesthetics. फर्स्ट वन इधर मिथोएक्सिटाल. इसमें मेडिसिनल केमिस्ट्री में थोड़ा सा बोरिंग टाइप का सब्जेक्ट है, ऑर्गेनिक केमिस्ट्री से अच्छा है. मिथोएक्सिटाल. सो मिथोएक्सिटाल मींस व्हाट? It is a barbituric acid derivative. So what is barbituric acid and all that we'll see in the upcoming session. Then we'll see sedative hypnotic drugs. So methoexytal, it is a ultra short acting barbiturates. Ultra short acting barbituric acid derivative. So we'll see. Methoexytal is also ultra short acting. That also thiopentone sodium. Thiopentone sodium is also ultra short acting. So thiopentone sodium का structure ये है. So methoexytal sodium. यहाँ पे स्ट्रक्चर आप बोलेंगे सर स्ट्रक्चर कैसे याद रखें? मेन तो बेसिक जो रिंग है दैट इज बारबिट्रिक एसिड रिंग, वो तो कॉमन रहेगी. ठीक है, ये हो गया आपकी बारबिट्रिक एसिड. ये हो गई आपकी बारबिट्रिक एसिड रिंग. इट इज नोन एज अ pyridine C. pyridine 2 4 6. ये हो गया कार्बन नंबर 1. इसको 1 बोलेंगे, इसको 3 बोलेंगे. ये होगा 2। pyridine जो है 6 member ring with 1,3 nitrogen known as a pyridine. So pyridine 2,4,6 pyridine 2,4,6 trion, 3 कीटोन है ना, so trion. So pyridine 2,4,6 trion is known as a barbituric acid. Now this one is known as a fifth position. This one is known as a fifth position. इसके ऊपर सब्स्टिट्यूशन होगा, so it is इसके ऊपर ही सब्स्टिट्यूशन होगा. Now methohexital, hex मतलब कितना, hex मतलब 6. Okay, so there are 6 carbon atom chain over here. So you can see 1, 2, 3, 4, 5. Methohexital means 6 carbon atom side chain is there. So you can remember the structure likewise. So 6 align. Okay, so 5 align, 5 hex 3, hex मतलब 6, hexane 3, 3 hexane 3 1 into methyl pyrimidinium 2,4,6 triol. तो ये सब नीचे वाले जो लाइन है, तो उसको आप इतना भी लिख सकते हो कि पूरा उसको बारबीक्यू एसिड बोल के लिख सकते हो. ये जो लाइन है लास्ट का, so whatever the this line methyl pyridine 2,4,6 trion, so you can change this whole line with a single word barbituric acid. So उसका नाम क्या होगा, 5 allyl, 5 allyl, ये allyl ये हो गया 5 allyl, 5 hex, 5 hexane 3 5 hexane 3 allyl hexane. तो ये 1 methyl pyrimidine 2,4,6 trion को आप barbituric acid बोल सकते हो. So 1 5 allyl 5 hexane 3 barbituric acid, that is the IPAC name of your methohexital. इतना सिंपल होता है. Then next one is thiopental sodium or thiopental sodium. So it is a sodium salt of thiobarbituric acid. Okay, thiobarbituric acid. तो इसमें कहाँ पे भी सल्फर नहीं दिख रहा है, इसमें सल्फर है. तो इसका लिपिड सोलिबिलिटी बढ़ जाता है बिकॉज ऑफ दिस सल्फर. लिपिड सोलिबिलिटी ऑफ दिस मॉलिक्यूल इज इंक्रीज्ड एंड ड्यूरेशन ऑफ एक्शन इज डिक्रीज्ड. सो इट इज अ थायोपेंटल सोडियम. सो अगेन बारबिट्रिक एसिड कॉमन रहेगा, तो यहाँ पे सिर्फ बारबिट्रिक एसिड की बजाय आप क्या बोलेंगे, थायोबारबिट्रिक एसिड, क्योंकि यहाँ पे सल्फर है. सो यू कैन से थायोबारबिट्रिक एसिड. सो वट एवर दिस स्केलेटन इज देयर, ये जितना स्केलेटन है उसको क्या बोलेंगे, थायोबारबिट्रिक एसिड. नाउ 5 पोजीशन पे क्या है, देखो यहाँ पे क्या है, यहाँ पे इथाइल, यहाँ पे क्या है पेंटिल, ये क्या है पेंटिल. पेंटिल कहाँ पे देखो 5 मेंबर कौन है, 1. सो सोडियम 5 इथाइल 5 इथाइल 5 इथाइल इंटू 5 पेंटिल 2 इन बारबिट्रिक एसिड. ये सिंपल उसका आईपैक नेम होगा. ये पूरा उसको रिप्लेस कर दो थायोबारबिट्रिक एसिड. ठीक है, सो 1,1,4,5,6 टेट्राहाइड्रोपिरिमिडिन 2 थायोलेट, इसको पूरा थायोबारबिट्रिक एसिड बोला. सो यू कैन से दिस होल लाइन इनटू थायोबारबिट्रिक एसिड. पूरा लाइन आपको उसको थायोबारबिट्रिक एसिड बोल सकते. तो सोडियम 5 इथाइल 4,6 डाइऑक्सो 5 पेंटेन 2 इल थायोबारबिट्रिक एसिड. IPAC name of your thiopental sodium. Now this was a barbiturate. Now next drug is this propofol. Propofol, as I have already told you, this is a phenol derivative. It is a phenol derivative. तो अभी इसका सिंथेसिस भी पूछा आपको तो समझ में आना चाहिए. सिंथेसिस कैसे होगा इसका, फिनॉल, फिनॉल से होगा. ये हो गया फिनॉल मॉलिक्यूल, ठीक है ना बीच में का. सो ये फिनॉल लगेगा इसमें सिंथेसिस करने के लिए. और दूसरा क्या लगा, यहाँ पे देखो ये क्या है, आइसोप्रोपाइल क्लोराइड. ठीक है, यहाँ पे क्लोराइड डाल isopropyl chloride. So phenol plus 2 molecules of isopropyl chloride will give you propofol. What is the IPAC name? 2,6-diisopropyl. It is a propofol. It is again a general anesthetic agent. That is a propofol. So now thiopental sodium synthesized. It is synthesized by condensation of thiourea and ethyl 1-methyl-butyl malonate. Substituted malonic acid derivative. ये हो गया malonic acid and thiourea. So thiopental sodium is synthesized by condensation of thiourea and into ethyl 1-methyl-butyl malonic acid. तो malonic acid का जो है उसमें ये रहेगा, एक एसिड की जगह इथाइल रहेगा और दूसरे एसिड ग्रुप की जगह ये रहेगा ethyl 1-methyl-butyl. Thiourea plus malonic acid, substituted malonic acid will give you. Thiopental sodium is ultra short acting barbituric acid derivative. It has a rapid onset of action that is 30 सेकंड. इंजेक्शन देने के बाद में 30 सेकंड में ही उसका असर चालू हो जाएगा. सो दैट इज अ रैपिड onset of action and short duration of action. ड्यूरेशन कितना है, 10 to 30 minutes. And it is also used as a sedative, hypnotic and anti-epileptic. Now next we will see ketamine. So ketamine, as I have told you, it is a narcotic analgesic and it is known as a phencyclidine derivative. ये किसका डेरिवेटिव कौन है ये भी याद रखो, phencyclidine derivative. कैसा होता है phencyclidine. सो इसके ऊपर भी एक बार क्वेश्चन आ चुका है. वन ऑफ द फॉलोइंग ड्रग इज phencyclidine derivative. फेन साइक्लिक, फेन मतलब क्या है यहाँ पे, फेन मतलब फिनॉल है, साइक्लिक मतलब साइक्लोहेक्सेन। फेन मतलब क्या, फेन मतलब फिनॉल, फेन मतलब फिनॉल एंड साइक्लिक मतलब साइक्लोहेक्सेन, साइक्लोहेक्सेन। सो फेन साइक्लिक डेरिवेटिव बोलेंगे इसका स्ट्रक्चर देखो। सो इट इज द स्ट्रक्चर ऑफ योर फेन साइक्लिक, you can say this is a phenol, it is a phenolic ring and it is a cyclohexane ring, cyclohexane दिख रहा है आपको, cyclohexane. So phene cyclidine derivative, so phenol plus cyclidine. Ketamine is known as a dissociative anesthetic, so it will produce dissociative anesthesia because it produces the unpleasant hallucinations and strong feeling of dissociation from the environment. So anesthesia is produced with profound analgesia, means ये केटामाइन एनेस्थीसिया भी प्रोड्यूस करता है और अच्छा एनालिसिक ड्रग भी है. सो एनास्थीसिया विल बी प्रोड्यूस्ड अलोंग विद द एनेस्थीसिया, दैट इज अ केटामाइन. केटामाइन विल प्रोड्यूस डिसोसिएटिव एनेस्थीसिया, कम से कम 5 या 6 बार बोलो, तो लाइफ में कभी बोलना हो. केटामाइन इज अ नार्कोटिक एनालिसिक, so it is a derivative of your morphine. Does the modification of structure of morphine, you are getting this ketamine, and this ketamine is also used in the anesthesia and for the production of your dissociative anesthesia. So what is the IPAC name of this phencyclidine? We'll see. IPAC name मतलब तोड़ तोड़ के पढ़ो आप, याद करने का कैसे करने का है देखो. अभी देखो यहाँ पे क्या है, 2 into 2 क्लोरोफिनिल, 2 into 2 क्लोरोफिनिल साइक्लोहेक्सानोन. बेसिक रिंग क्या बोला है, साइक्लोहेक्सानोन, साइक्लोहेक्सानोन. ये रिंग जो है साइक्लोहेक्सान, तो इसको ये जो कीटन है उसको नंबर 1 देंगे आप, और ये जो कार्बन आइटम है उसको नंबर 2 देंगे. 2 into 2 क्लोरोफिनिल, 2 into उसके अंदर क्या है, क्लोरोफिनिल है, 2 क्लोरोफिनिल. तो ये बेंजीन रिंग में भी इसको 2 बोलेंगे ये पोजीशन को, और इसको बोलेंगे 1. 2 into 2 क्लोरोफिनिल, और उसी 2 पोजीशन पे क्या है, और मिथाइल अमाइन. ठीक है, मिथाइल अमाइन. 2 into 2 chlorophenyl 2 methyl amino cyclohexanone, that is the IPAC name of your ketamine. It is very simple. IPAC name be easily up. Now next drug is known as etomidate. Etomidate, so it is a 4 carboxylic acid ester substituted benz sorry substituted imidazole moiety. So carboxylic acid derivative है, imidazole moiety है उसमें, that is etomidate. It is a potent modulator of your GABA receptor. It increases the concentration of GABA. ये GABA का concentration बढ़ाएगा etomidate. So rest of mechanism, full mechanism we have seen in the pharmacology. Only structural aspects we are going to discuss over here. So see, carboxylic acid ester substituted imidazole, ये हो गया कार्बोक्सिलिक एसिड का ईस्टर, कार्बोक्सिलिक एसिड. देन ये हो गया आपका इमिडाजोल. तो जितने भी हेटेरोसाइक्लिक है, व्हाट इज मीन बाय पायरोल, व्हाट इज मीन बाय फ्यूरान, व्हाट इज मीन बाय इमिडाजोल, व्हाट इज मीन बाय थायोपिन, व्हाट इज मीन बाय एजेपिन, व्हाट इज मीन बाय पिरिडीन, व्हाट इज मीन बाय पिप्रेजिन. ये जैसे ही नाम आपके सामने आए, तो रिंग का स्ट्रक्चर ही आपके सामने आए. व्हाट इज मीन बाय पिप्रेजिन, एक बेंजीन रिंग, उसमें दोनों भी पैरा पोजीशन पे क्या रहेगा, नाइट्रोजन रहेगा, उसमें कोई डबल बॉन्ड नहीं, दैट इज अ पिप्रेजिन. अगर बेंजीन के रिंग में एक नाइट्रोजन है और एरोमेटिसिटी है, दैट इज नोन एज अ पिरिडीन. अगर एक 5 मेंबर रिंग है उसमें 2 नाइट्रोजन है तो उसको बोलेंगे इमिडाजोल. 1 3 नाइट्रोजन अगर है तो उसको इमिडाजोल बोलेंगे. तो हेटेरोसाइक्लिक रिंग आपको करना है, चाहे तो बाद में मैं एक लेक्चर उसके ऊपर भी ले लूँ. व्हाट इज द केमिकल नेम और आर्टिक नेम ऑफ दिस इंटरमीडिएट? So ethyl into 1 methyl benzene, ethyl into 1 methyl benzene, imidazole 5 carboxylate. Okay, imidazole 5 carboxylate. तो नाइट्रोजन 1, नाइट्रोजन 3, 1 2 3 4 5, ये कार्बन नंबर हो गया 5. 5 कार्बोक्सिलेट, कार्बोक्सिलिक एसिड का है इसलिए कार्बोक्सिलेट ईस्टर है. इस कार्बोक्सिलिक एसिड का इस कार्बोक्सिलिक एसिड का ईस्टर है इसलिए कार्बोक्सिलेट. नाउ इथाइल 1, इथाइल 1, इथाइल हो गया इथाइल, इथाइल 1 बेंजील इमिडाजोल 5 carboxylate. That is a chemical name of your IPAC name of your intermediate. Now next